Most people have heard of cancer. It's a word that stirs fear, worry, and urgency. But there's one kind of cancer that doesn't always make headlines, doesn't always show obvious symptoms, and often hides in silence until it's too late. That's pancreatic cancer. Pancreatic cancer is one of the most dangerous types of cancer today, not because it spreads faster than others, not because it causes intense pain early on, but because it gives us so few warnings. It grows quietly, often without clear symptoms, until it reaches a stage where treatment becomes extremely difficult. Many people live their everyday lives working, eating, sleeping without realizing that something deadly may be developing deep inside their abdomen. By the time they feel something is wrong, the disease may have already advanced. That's what makes pancreatic cancer so deadly. It's not just a medical challenge, it's a silent threat. And sadly, most cases are not diagnosed until the cancer has already spread beyond the pancreas. If you're thinking, I feel fine, so I must be healthy, you're not alone. That's exactly what most people with early-stage pancreatic cancer believe until it's too late. The scary truth is that by the time clear symptoms appear, the window for effective treatment may already be closing. But this doesn't have to be your story. You see, early detection saves lives. That's not just a slogan, it's a reality. If pancreatic cancer is found before it spreads, the chances of living longer and better increase dramatically. The problem is, most people don't know what to look for. They don't know what signs to notice. They ignore small changes, thinking they're just part of getting older, or maybe just stress or poor digestion. Today, we're going to change that. In this video, you'll learn what to watch out for, what your body might be trying to tell you long before the problem becomes serious. You'll discover the early warning signs of pancreatic cancer, explained in simple terms, so that you can take action before it's too late. No panic, no fear, just knowledge, because the more you know, the better prepared you are. And when it comes to pancreatic cancer, being prepared could save your life or the life of someone you love. So stay with us. Let's talk about why early detection matters. Pancreatic cancer is often called a silent killer for a reason. By the time it begins to show clear symptoms, it may have already reached an advanced stage 1 where surgery is no longer an option, and where treatments become more about managing pain than curing the disease. But here's the good news. If pancreatic cancer is caught early, before it has spread beyond the pancreas, the chances of successful treatment increase significantly. In fact, early-stage pancreatic cancer can sometimes be treated with surgery followed by additional therapies, giving patients the best shot at longer survival. The challenge, however, lies in the timing. Unlike other cancers that may show visible lumps or cause persistent coughing or bleeding, pancreatic cancer often begins with vague, easily overlooked symptoms: fatigue, stomach discomfort, slight weight loss. These are the kinds of signs that people tend to dismiss. Maybe it's stress. Maybe I ate something bad. It'll go away. Unfortunately, that delay can cost precious time. This is why awareness is everything. The more you understand what's normal for your body and what's not, the more likely you are to catch changes early. You don't need to become a doctor. You don't need to run to the hospital for every small ache. But you do need to pay attention to patterns that don't make sense, signals that persist, symptoms that slowly build, even if they seem minor. Early detection is not just about medicine, it's about giving yourself options. When cancer is discovered early, doctors have more tools they can use. You have more treatment choices. You have more time. You have hope. It's also important to remember, no one knows your body better than you do. If something doesn't feel right, it probably isn't. And while it may turn out to be something harmless, isn't it better to check now than to wait until it's too late? Even if it's not cancer, early attention to symptoms can help you catch other health issues like gallbladder problems, digestive disorders, or even early-onset diabetes. So nothing is lost by staying informed and being proactive. Think of your health like a fire alarm. You hope it never goes off, but if it does, you want to catch the smoke, not the flames. That's why we're here, to help you recognize the smoke before the fire ever has a chance to grow. In the next part, we'll talk about what those smoke signals actually look like, the early signs your body may be showing you, and how to tell the difference between something minor and something that might deserve your full attention. Let's move on to those early warning signs. Now let's get to the part that could truly make a difference: the early warning signs of pancreatic cancer. These are the signals your body may be sending, quietly, subtly, and over time. They're not always dramatic. In fact, that's the challenge. They often appear mild or unrelated. But the truth is, recognizing these symptoms early could mean the difference between a fight you can win and one that becomes much harder. Let's go through the most common early signs, one by one. 1. Abdominal pain that radiates to the backbone. Of the most frequent early signs of pancreatic cancer is discomfort in the upper abdomen. This pain may feel dull, nagging, or icky, and it often radiates through to the back. The reason for this is anatomical. The pancreas lies deep inside your abdomen, close to your spine. As a tumor grows, it may press on surrounding nerves and tissues. People often mistake this kind of pain for indigestion, muscle strain, or stress. But if the pain is persistent, especially if it worsens when lying down and eases when sitting forward, it's time to speak with a doctor. 2. Unexplained weight loss. Have you lost weight without trying? Are your clothes fitting looser even though your diet hasn't changed? Sudden, unexplained weight loss is often one of the first noticeable signs of pancreatic cancer. It may occur due to the cancer interfering with your body's ability to digest and absorb nutrients. It may also be related to loss of appetite or metabolic changes triggered by the tumor. If you've lost more than 5 to 10 pounds without any clear reason, it's worth checking out. 3. Loss of appetite. Decreasing interest in food can sneak up gradually. Meals that once excited you may now leave you feeling indifferent or even nauseous. This is another subtle sign that the pancreas isn't functioning normally. Some people also experience early satiety, feeling full after only a few bites. It may not seem like a big deal at first, but combined with weight loss, this change in appetite can be a red flag. 4. Jaundice. Yellowing of the skin and eyes. This is one of the most visible and specific signs of pancreatic cancer, especially when the tumor is located near the head of the pancreas, where it can block the bile duct. Jaundice causes yellowing of the skin and the whites of the eyes. It may also come with itchy skin, dark-colored urine, and light or clay-colored stools. Many people notice a change in their eyes before anything else. If you or someone you love suddenly appears yellow, it's not something to wait on. 5. Changes in stool and urine color. As mentioned, when the bile duct is blocked, digestion is affected. Bile gives stool its brown color, so if that flow is interrupted, stool may become pale, gray, or greasy. At the same time, urine may darken, sometimes looking like tea or cola. These changes can seem odd, even alarming, but they're worth recognizing as potential signs of pancreatic trouble. 6. New onset diabetes or worsening blood sugar control. In some cases, pancreatic cancer affects the cells that regulate insulin. This can lead to a sudden diagnosis of type 2 diabetes in a person with no prior history or risk factors. Even people who already have diabetes may find that their blood sugar becomes harder to manage without any clear reason. If you've recently been diagnosed with diabetes, and especially if you're also losing weight or experiencing fatigue, it's important to consider a deeper evaluation. 7. Fatigue that doesn't go away. Everyone feels tired from time to time, but persistent fatigue, especially the kind that doesn't improve with rest, can be a sign of something more serious. Cancer-related fatigue feels different. It can be a deep, unshakable tiredness that affects your ability to do normal activities or concentrate during the day. Fatigue alone doesn't mean cancer, but combined with other symptoms, it shouldn't be ignored. 8. Digestive problems and bloating. Indigestion, gas, bloating, or changes in bowel habits can also appear in the early stages of pancreatic cancer. These issues often overlap with common conditions like irritable bowel syndrome or acid reflux, which makes them easy to dismiss. But when symptoms linger or worsen over time, especially in combination with other warning signs, they need medical attention. 9. Nausea and vomiting. As a tumor grows, it may block parts of the digestive tract. This can cause nausea, occasional vomiting, or a feeling that food just sits in your stomach too long after eating. If these symptoms become more frequent or show up alongside loss of appetite and weight loss, they're worth investigating. 10. A gut feeling that something is off. This may sound vague, but it's real. Many people with serious illnesses say they had a sense that something wasn't right long before tests confirmed it. Whether it's a general unease, a sense of offness, or a change you can't quite explain, it's okay to listen to your instincts. Your body often knows before your mind catches up. These signs don't mean you have pancreatic cancer. They may be related to much more common and treatable issues. But if any of these symptoms are new, persistent, or getting worse, don't brush them off. In the next section, we'll talk about what to do next and why staying calm and seeking the right help is the most powerful thing you can do for yourself or someone you care about. If you've been listening closely and recognize one or even a few of the warning signs we just talked about, you might be feeling uneasy right now, maybe even a little scared. That's completely normal. But here's the most important thing to remember. Don't panic. Feeling a symptom does not mean you have pancreatic cancer. Many of these signs can be caused by much more common and less serious conditions. Digestive issues, back pain, fatigue. These things can happen for many different reasons. Stress, diet, lifestyle, even age can play a role. So before your mind jumps to the worst case scenario, take a deep breath. The goal here isn't to scare you, it's to inform you. The best response to any unusual symptom is calm, focused action, not fear. So what should you do next? First, track your symptoms. Write them down. When did they start? How often do they happen? Do they follow meals or time of day? Do they come and go or stay constant? This kind of information is incredibly helpful when you see a doctor. Next, schedule an appointment with your primary care physician or a gastroenterologist, a doctor who specializes in the digestive system. Let them know what you've been experiencing and for how long. Don't hold back or downplay your symptoms. Be honest. Be specific. Sometimes, it takes a few visits and a few tests to get to the bottom of things. Blood work, imaging scans like ultrasounds or CT scans, and perhaps even endoscopic procedures may be used to investigate further. And remember this. Getting checked doesn't mean something is wrong. It means you're being smart. You're being proactive. You're taking responsibility for your health, and that's something to be proud of. If nothing serious is found, great. That's a win. Peace of mind is just as important as any diagnosis. But if there is something that needs attention, finding it early puts you in the best position possible to deal with it effectively. Here's the truth most people forget. Early discovery is not just about survival. It's about quality of life. It's about having options. The sooner you know, the more choices you'll have and the less aggressive those choices may need to be. Think of it like this. Would you rather face a problem when it's small, manageable, and still under your control? Or wait until it's grown larger, more complex, and harder to handle? By choosing to act early, you give yourself the gift of time. Time to plan, time to heal, time to live the life you deserve. So if something feels off, speak up. If symptoms persist, follow through, and most of all, trust yourself. You are your own best advocate. In the next section, we'll bring everything together with a final message to help you take control of your health and move forward with confidence. Now that you understand the quiet nature of pancreatic cancer and the signs that could signal its early presence, it's time to talk about something even more important, your power to act. In today's world, we're often told that health is something that just happens to us, that getting sick is a matter of chance or genetics. And while it's true that we can't control everything, here's the truth that many people overlook. You have more control over your health than you think. Every time you pay attention to your body, every time you follow up on a symptom instead of brushing it off, every time you choose to speak with a doctor, get a test, or ask a question, you are taking back control. You're not helpless. You're not a victim. You're someone who cares deeply about living fully, living wisely, and living long. It starts with awareness, and that's what you've already done today just by watching this video. Just by listening and learning. That's a powerful first step. But don't stop here. Take what you've learned and apply it to your life. Pay attention to how you feel. Be honest with yourself. Make time for checkups, even if you feel fine. And most importantly, don't let fear keep you from finding answers. Because knowledge isn't scary. Silence is. And when you combine knowledge with action, you create the best possible path forward not only for yourself, but for your family, your friends, and everyone who cares about you. Remember, the earlier pancreatic cancer is detected, the more options you have. The more options you have, the better your outcome can be, and better outcomes mean better days, more memories, more moments to enjoy. So take this moment, let it be your reminder, your wake-up call, your motivation. Your health is not something to be put on hold. It's something to honor, to protect, and to prioritize starting now. In a world full of distractions, you've taken time to focus on what truly matters. That's something powerful. That's something worth sharing. You're not just watching a video. You're becoming part of a movement of people who take their health seriously and support others to do the same. You're not alone in this journey, and you never have to be. If this video helped you understand pancreatic cancer better, if it made you pause and think about your health or the health of someone you love, then don't keep it to yourself. Share this video with your family, your friends, your neighbors, anyone who might benefit from learning these early warning signs. It might be exactly what they need to hear today. Send it to someone you care about. Sometimes, we don't know how to start a conversation about health, but sharing a video like this can open the door. Leave a comment below. Tell us your story. Have you or someone you know dealt with pancreatic cancer? Are you noticing symptoms and planning to talk to your doctor? Your words could inspire someone else to take action. Subscribe to our channel if you haven't already. We're committed to helping you stay informed about the most important health issues, especially the ones that often go unnoticed. Every week, we release videos just like this, focused on early detection, healthy living, and practical guidance for real people. And of course, don't forget to like this video if you found it helpful. That simple click helps this message reach more people across the world. This is just the first in a special video series about the most common and most dangerous types of cancer. In the next episode, we'll talk about lung cancer, another major threat that often shows up delayed. So hit that notification bell to stay updated when the next episode drops. And finally, wherever you are right now, take a moment to thank yourself for showing up, for caring, for taking your health seriously. You deserve to live well. You deserve to be informed. And we're here to walk that journey with you step by step, one video at a time. Stay strong, stay aware, and as always, take care of yourself and those you love.